Patient testimonials and patient stories. Can you use them? Yes, but very carefully. With the use of the internet exploding all around us and the use of other kinds of social media, we're using more and more of these patient testimonials and patient stories, perhaps to imply or suggest outcomes which are not necessarily totally consistent with the data and with the package insert as written. We often, again, use them to imply outcomes, and we want to show, therefore, the patients who've had the very best results. Unfortunately, one of the considerations we have to think about all the time is the way we use these in any way overstating efficacy or implying expanded outcomes. For instance, if we want to talk about using a patient that says their school results were improved, or that they had slowing of historically normal renal function decline, then that might be an expansion of outcomes that the data doesn't support. So if you think you want to use these, what are the considerations you actually need to think about as you do that? Well, first, the patient you select has to be consistent with your approved labeling and with the data that you use to generate that labeling. Remember, a patient is an N of 1. It doesn't represent substantial evidence. And if you want to imply or suggest any type of claim, is substantial evidence that's always the default that you have to go to support that claim. Next, whatever the patient says has to actually be truthful for that patient. You can't go back and create something that didn't happen. And you also have to ensure that safety is represented there in a way that's consistent with your labeling, even if that's not the case for that specific patient. Next, what the patient says or implies, even through graphics or visuals like pictures, can't overstate efficacy in terms of implying through a misleading way an outcome that the average patient might expect to receive when they take your drug. Remember again, the patient is an N of 1. Think of a bell curve, that bell curve you studied in 7th and 8th grade as you were coming along through school. You might be tempted to think about using that tail on the right-hand side, that 2% of patients who had the very best results in your clinical trials. Unfortunately, though, for you, if you're marketing and you'd like to have a patient that really looks fantastic, what your regulatory and legal folks are going to tell you is you really have to choose that patient that represents the more center of the bell curve, one that's more likely to be representative of the average patient who takes your drug. So back to the question, can you use patients to tell a story? Can you use patient testimonials? The answer again, yes, but carefully.